Pelvic floor issues can be uncomfortable, frustrating, and even isolating. The good news is they are treatable. We're back with Anna House of Active Physical Therapy in Marquette to discuss some of those symptoms. Anna, I guess what are some main issues that are signifying that a woman has poor pelvic floor health?
I would say the number one thing people come to me for is usually leaking of urine. I think a lot of us think that that's just normal, especially after we have babies. I always hear people say, oh, I just had a baby, that's normal. The reality is that we should be totally continent, I would say 95% of the time. And if that's not the case, there's things that we can do and look into. And it's not just about, like we talked about earlier, just doing Kegels. It's also taking a step out of the pelvis and understanding, what does core strength look like? How am I managing pressure so that when I jump or do a jumping jack, what are my breathing mechanics, and am I able to withstand some of that pressure that arises? And if I can't, then my bladder takes the path of least resistance, and that results in leaking. So there's a lot of things that we look at, and it's definitely more than just looking at Kegels. But some other things that are really common that we treat are pelvic organ prolapse, and that's just when the organs will shift in the pelvic cavity, which is can commonly occur during childbirth or after childbirth. And then also diastasis recti, which is a separation of the rectus abdominis, your six-pack muscle. Pelvic pain, of course, and anything to do with your bowels, so either constipation or fecal incontinence. I'll also see a lot of women after abdominal surgeries, things like hysterectomies or otherwise. And sometimes as part of those procedures, you can develop scar tissue, which becomes uncomfortable, and we can help mobilize that and optimize pelvic floor function.
So what might a treatment plan or a treatment option look like for a woman experiencing incontinence or another pelvic floor issue?
So the interesting thing about that, I can't give you a simple answer with that, because there's different forms of urinary incontinence. So with stress urinary incontinence, that's more of the leaking with laughing, sneezing, coughing. And urge urinary incontinence is more so associated with, I have this urge to go to the bathroom, but I just can't make it in time. And so we treat those separately. So we're really treating the individual and based on what they present with. So for example, I'm looking at what is pelvic floor strength, coordination, endurance, what does the tissue surrounding the bladder and urinary system look like, and how can we best optimize that? And what I like to say is we're giving your bladder a happy home. And so that means not only the pelvic floor, but also the core and the surrounding fascia and tissues and the nerves. Nerve health is a big part of this as well.
So what is treatment, so what does treatment look like for a physical therapy session if somebody comes in and they're saying like they may have intercourse pain or postpartum after having a baby? What treatment do you guys do in order to help somebody out?
Yeah, so I think the thing that will give us the most information is doing an internal pelvic exam, and that is how we get to these muscles. I tell people though that if they're not comfortable with that idea, there's other ways in which we can examine the pelvic floor, but there's nothing like an internal exam which will help us to better understand the function, the tension, the other various factors that can contribute to pain in the pelvic floor. Sex, just like periods, should not be painful for people. And if it is, there's reasons why those things can occur, and there's treatment available so you don't have to live with those symptoms.
Do you tend to see an older demographic of people, or are your clients patients that range across the board with age?
Definitely range across the board with age. I see people as young as in their teens who are struggling to use a tampon and can't use one, and then through physical therapy, through different kinds of various treatments, we can help them achieve that goal, to late in the lifespan, where folks are dealing with usually an increasing amount of urinary incontinence, and then everywhere in between. So my day really varies, and I see people throughout the lifespan.
To become a client of yours, does one have to go through their primary care doctor, or do they call the Active directly?
It's usually best with billing insurance to get a referral from your doctor, and also just to check in with your doctor first before coming to PT, just to make sure there's not something else that needs to be done before you come to physical therapy. I would also say that this kind of physical therapy is oftentimes different than your typical shoulder or knee, where we can usually achieve a good bulk of things in, depending on the situation, not as many visits as you might typically expect.
So I wanted to ask another quick question. Yesterday on UMT, we just did an episode about posture for Posture Awareness Month. What does posture have any play on pelvic floor health?
Absolutely. You know, the pelvic floor doesn't exist in a vacuum in isolation. And so other components of the body, posture is a really big one, strength in other areas of the bodies affects our pelvic floor function, how those muscles operates, and how we control pressure.
So it's all connected.
It's all connected.
It's like just one big machine. If something doesn't work, then it all doesn't work.
It's true. One of the very first things I do with people on their first day is breathing mechanics, because there's a relationship between our diaphragm, which is our main muscle of respiration at our rib cage, and our pelvic floor, and they operate together as a team. And so breathing is usually every single person that walks through the door, we talk about breathing mechanics.
Breathing can be a super helpful, important tool. That's all the time we have for right now. Anna, I wanted to thank you for your expertise and for being a part of our conversation regarding women's health.
Thank you for having me.
Of course, and you should stay with us. We have more on pelvic floor strengthening when we return.